Los Angeles County is considering reinstating an indoor mask mandate as COVID cases there continue to rise.
Last week, health officials said it would only happen if the county reaches high transmission levels. Right now, they are at medium. Health officials say the county is averaging more than 2,100 new COVID-19 infections per day, but they say the number could be much higher because many people do not report results from at-home rapid tests.
For more, let's bring in Dr. Jerry Abraham. He is the director of Kedren Vaccines at Kedren Health. That's where I got my first shots, I have to tell you, Dr. Abraham. First and foremost, what's driving the case numbers up, and how much worse do you expect it to get?
Yeah, I mean, we predicted this, that we would gather for Thanksgiving and the holidays. The weather is getting colder. And so we're huddled together. And of course, that's a perfect environment for these bacteria and viruses to spread, really be contagious. And so we really, saw this coming in some ways. And so we just really have to make sure that we're prepared for it.
So there are also fears that we're nearing what people are calling a tripledemic, which includes the flu, COVID, and RSV circulating at the same time. What are you experiencing firsthand in your hospital, and how severe do these cases seem to be?
Yeah, so this is this tripledemic, RSV, COVID, and flu. And so it's just this perfect storm of pathogens that can affect different people differently, including our elders or those that have underlying medical conditions. And so really you've got sometimes older folks or sicker folks getting hospitalized for the flu. You've got kiddos getting hospitalized for RSV. You've still got COVID in the background, and that takes up beds, and that really does back up whether or not we can get people upstairs, whether our emergency room gets crowded, and really how we're going to triage that. And also knowing that we also have to always be ready for people that have heart attacks or trauma. So it really is a balancing act.
So with that in mind, I mean, and with these diseases all having overlapping symptoms, what do you do if you get sick?
Right. I think it's very important to know when to go to the emergency room. I think it's always wise to call your doctor's office, the clinic that you go to, and get some advice. Generally speaking, with children, if they're acting lethargic, their behavior has changed, they're less fussy than usual, those may be signs that your kid needs to be evaluated further. We're always concerned about heart rate and respiratory rate, how quickly or how slowly you're breathing. Things like if they look more bluish, their fingertips or their lips, those are ideas that they may not be getting enough oxygen. Those kids should be evaluated in an emergency room.
Well, Dr. Jerry Abraham, thank you. Did you hear that, Vlad? It's normal for kids to be fussy, just so you're prepared.
I'm prepared. I'm prepared for that. Doctor, thank you very much. Appreciate it.
Thank you.